Welcome back. This is Dr. Jin Sung, where clinical excellence meets excellent results. Today we're going to talk about a test which I feel is the #1 screening test for cardiovascular risk. So let's get right into it. #1 screening test for cardiovascular risk. It's called a calcium coronary artery scan. It's equivalent to about 7 to 8 chest x-rays, and it costs only $150 to $200 without a doctor's referral. So basically you can go and schedule yourself at a clinic or a diagnostic facility and get the scan. The positive is this: a positive stress test and patterns of ischemia with an echocardiogram requires at least 50% blockage. So when you do these other tests where they do echocardiograms, your blood vessels have to show at least 50% blockage in order to show up. So this is more for those people who are more advanced to see if you have blockage. The calcium coronary artery scan gives you very early indication of plaquing within the arteries of the heart, right? So it looks at early intervention. So if you have different scores on this calcium score, then you can do modifiable factors to improve those scores. So let's get right into some of the rating. So when they do the scan, they give you a different number. So for that scan, if 0 is the number that you get, you will have absent or no risk of cardiovascular injury. If you have 1 to 10, you have minimal atherosclerosis and you have very low risk of heart attack and stroke. 11 to 100, you have mild coronary stenosis and you have a mild risk. 101 to 400, you have moderate, reasonable amount of plaques and you have a moderate risk of cardiovascular events. Over 400, you're in trouble. It's very high. It's a very significant risk of heart attack and stroke. So this simple scan can give you early indications if you're having plaquing. So let's say you did a scan and you came out and it's 0. Great. I wouldn't do another scan for at least 3 to 4 years to check up to see if it's maintaining at 0 or has the numbers gone up. If you have numbers, let's say right in here, you want to do a lot of modifiable factors, improve your diet, nutrition, sleep, stress, and all the other things, and then repeat the test maybe about a year out to see if it reduced or it's stabilized. If you're above 400, right, you're not going to go back to 0 because you have significant or moderate amounts of plaquing within the artery. It'll show up on your echocardiograms. So it's not something where you go, I'm going to keep repeating this. You have to do a lot of lifestyle and management and so forth. So this calcium coronary artery score or scan is very, very good in indicating cardiovascular risk. And it's relatively cheap and a simple thing to do and repeat. Now, it does give you some radiation, so you want to be careful because it is equivalent to about 7 to 8 chest x-rays. The other modifiable factor here is blood pressure. So something you can do at home. So what I would do is you get a little blood pressure cuff machine. There's a company called Omron, which is very, pretty good. It's accurate. So then check your blood pressure daily or twice a day and to see if your blood pressure is within normal reference range. Ideal numbers should be below 120, right, for systolic and below 80 for diastolic. That would give you an indication of where your cardiovascular risk would be. If your blood pressure is rising, you want to be careful and you want to do modifiable factors, lifestyle factors, and so forth to improve blood pressure, because blood pressure is one of those things that can easily check at home, and you can easily do a coronary calcium scan to see your cardiovascular risk. And the importance of this is that cardiovascular injury is silent. High blood pressure is often silent. You don't realize you have it. And if you have plaquing in the arteries, you don't really notice it until you get at least 50% blockage of those arteries, where you have maybe peripheral artery disease, right? Or discoloration in your skin in the lower extremities, or you have coldness in your toes and fingertips. So it's a early indicator in how you would screen somebody for cardiovascular risk, okay? In my next video, we're going to talk about my strategies and other nutrients that you could utilize to help with cardiovascular damage. The other thing would be in terms of improving your lifestyle and stress management. However, even those recommendations is not a blanket statement for everybody. Why? Because people have peripheral artery disease or cardiovascular disease due to different mechanisms. So even though we can give you generalized recommendation, if you want specific recommendations for your specific condition and why you may have cardiovascular risk, you really need to speak to someone who understands what's going on and makes those modifiable changes. Because let's say you have vascular damage, but you have H. pylori, and H. pylori is impacting the plaquing in your arteries. You have to address H. pylori. You can't just take magnesium, right? So there are a lot of modifiable factors that can be generalized, or you can specify specifically for your condition. What are some of the things that are stressing your arterial systems, and what can you do to help improve those functions, right? And that would be more of a personalized lifestyle approach or a functional medicine approach in order to help someone who's got a specific condition. Today we're going to talk about cardiovascular disease, heart attack, and stroke, and the two supplements that are shown in studies to help improve or prevent heart attack, stroke. Now, these two supplements are meant to be used as a broad-based recommendation. It's not an individualized recommendation, much like what we would do if you came into our office. In our office, we would do workup, and would do maybe a coronary calcium score, homocysteine, lipid panels, and all the other things to make modifiable changes. However, what we're talking about today is just some meta-analysis of multiple participants over multiple studies that show effectiveness in terms of reducing the risk of cardiovascular disease and stroke. So let's get right into it. Heart attack, stroke, two supplements. This is based on a meta-analysis, which means it's taking a lot of different studies and a lot of different participants and doing the analysis of those studies. So what they concluded was preventable benefits from folic acid and B vitamins for stroke has been graded with moderate quality. So, B complexes reduce stroke risk by 10%. Folic acid reduces cardiovascular risk by 17%. Folic acid reduces stroke risk by 21%. So these are actually pretty good numbers considering you're just using a type of supplement to help reduce cardiovascular risk. It's not talking about diet, it's not talking about sleep, it's not talking about stress. We're just talking about one supplement, okay? The other supplement is fish oils. So they did a meta-analysis over 40 studies with over 134,000 participants. The results of that study shows EPA-DHA, or fish oil, is an effective lifestyle strategy for cardiovascular disease prevention, and the protective effects probably increases with dosage. What that means is that the higher the dose of fish oils that you take, the more benefits you can reap from it. So higher doses seem to be better in terms of reducing cardiovascular risk. Now remember, cardiovascular disease remains the leading cause of death worldwide. The problem with cardiovascular injuries or cardiovascular deaths, like heart attack and stroke, oftentimes there is no symptoms until you actually get a stroke or a heart attack. So one day this person who's healthy, eating well, doing everything right, sleeping well, at 50 years old dies of a heart attack or gets a stroke, right? Why would that happen, right? It's because there were things that were leading up to that moment, which is unrecognized. You don't really notice that you have high blood pressure. You don't notice that you have plaquing in your arteries. There's really no symptoms until you get to the point where you have a cardiovascular injury or stroke, okay? So it's a leading cause of death. So fish oil, the reason it has the benefits for cardiovascular protection is that fish oil reduces inflammation, reduces platelet aggregation. What that means is that prevents clotting, decreases blood pressure, has an antioxidant effect. It protects the endothelium of the vessels of the arteries and decreases triglycerides. So it has a multifold effect on how it works. Now, I know there are studies more recently that show that there are a very small percentage of people who may have AFib related to fish oil intake or higher doses of fish oil intake. However, based on those studies, it seems like they used more of the pharmaceutical ethyl ester form of the fish oil rather than the natural triglyceride form of fish oil. So if you have a cardiac condition, if you have cardiovascular disease history, or a history of AFib in the family or in yourself, I would talk to your physician or cardiologist before taking high doses of fish oil, okay? So those two supplements, basically folic acid or B vitamins and fish oil. In terms of folic acid, I prefer a methylated folate that would be probably better absorbed into our system. So a methylfolate, and then fish oil has some problems with being more rancid or the quality controlled or heavy metals. If you can get a good company that produces fish oil and tests for heavy metals and produces high quality fish oil, you should reap the benefits of taking fish oil. Today we're going to talk about avocados and cardiovascular disease. This is a recent study that just came hot off the press, so let's go ahead and discuss some of the findings. It's a 30-year study where they selected 121,700 registered nurses. Of them, they eliminated people who had cancer, coronary heart disease, and stroke, and they were left with 68,786 females ages 30 to 55. And they had 41,701 males ages 40 to 75 years old. Now, they did 2 servings per week, 2 servings of avocados per week. And then they did a baseline questionnaire prior to the study, and then did a questionnaire every 4 years to determine if they had any issues with cardiovascular systems. They also did a statistical analysis where they replaced margarine, butter, egg, yolk, cheese, or processed meats, half a serving of one of them, with a half a serving of avocado. And they did a statistical analysis to see if there were other benefits to replacing these types of foods. So what did the study show? There were a total of 14,274 incident cases of cardiovascular disease. Of that, 9,185 were coronary heart disease, and then 5,290 were stroke, okay? So why did they pick the avocado? Avocado is nutrient dense, right? It's really a superfood. It has a lot of dietary fiber, insoluble fiber. It has a lot of potassium, 500 to 800 milligrams per serving. It has magnesium. It has monounsaturated fats. And monounsaturated fats have been shown to decrease LDL cholesterol and increase HDL cholesterol, right? It also has polyunsaturated fats, not a lot, but it also has a lot of phytonutrients, and it has an omega-9 called oleic acid. It's about 13 grams. So there's a lot of nutrients in avocado. So what was the conclusion of this study? The conclusion, 16% reduction in coronary vascular disease, right? Your cardiovascular system. There was a 21% reduction in coronary heart disease, vasculature to the heart, right? It had no statistical difference for stroke. So it didn't impact the number of strokes with avocado consumption. Now, prior I said they did a statistical analysis where they did a model to see if you replaced those foods with half a serving of avocado every day. And they came up with 16% to 22% reduction in coronary heart disease and cardiovascular disease overall. So if you replaced half a serving of the eggs, the dairy, and so forth with avocados, then you can decrease your cardiovascular incidence by 16 to 22%. So this is not a perfect study, but it's a pretty good one. And it shows you how a nutrient-dense food can be beneficial for the cardiovascular system. The good thing about avocado, it's also keto-friendly and it's packed with nutrients. So it's a really great food. I personally probably have maybe 3 to 4 servings of avocado on a weekly basis. So tell me how many avocados you eat in the comments below, and what is your health like? Today we're going to talk about the egg. Is it bad for our heart, and does it cause damage or arterial disease? So let's get right into some of the studies. They did a meta-analysis study. There was 23 studies involved with 123,660 participants or cases. The conclusion, higher consumption of eggs, more than one egg, was not associated with increased risk of cardiovascular disease, and in fact, but was associated with a significant reduction in risk of coronary artery disease. So for many years, they used to think that the cholesterol in eggs was causing a problem, and they did this study that was really poorly made, and it was showing that increased cardiovascular disease. In actuality, it actually decreases coronary artery disease, right? Big meta-analysis study. They did another study, 36 subjects over 14 weeks, and basically they gave them 1 egg per day, and it showed that it increased HDLs, right? Which is quote unquote the good cholesterol, but there is no good or bad, you need both. But it increased HDLs, and it increased the large LDLs. So if the particle size of an LDL is very small, they tend to get embedded into some of the damaged arteries and plaque. So the larger the particle size of the LDL, the better you are. So the study actually shows that it increases large LDLs. When they ate 2 to 3 eggs per day, greater improvement was noted exponentially for HDL as well as large LDLs. So 1 egg makes a difference, but if you eat 2 or 3 eggs, you get a much bigger benefit out of eating eggs. So conclusion is, increases HDLs, increases large LDLs, and increases plasma antioxidants. So there's a lot of nutrients in eggs that can be quite beneficial. So there's a global benefit of eating eggs. So 1 egg has about 187 milligrams of cholesterol, or about 212 for a large egg. So I looked up some studies, and it showed that if you have 1,000 milligrams of cholesterol intake, it increases total cholesterol by a whopping 11 points, right? And if you took in 1,000 milligrams per day, increases 8 LDLs by a whopping 4 points, and HDL actually goes up by 3 points, so, right? And then when you took 400 milligrams per day, increased total cholesterol 2 points, LDL 2 points, and HDL actually went down 1 point. My point is that if your dietary cholesterol is higher it really doesn't have much of an impact on total cholesterol in the serum. Your liver is responsible for making most of the cholesterol in your body, and when you take in more dietary cholesterol, your liver simply produces a little less. Therefore, dietary cholesterol intake has minimal impact in total cholesterol in the serum. Okay? So I am a big fan of eggs. And if you look at the nutritional content of eggs, it has protein, really complete, high quality protein. It has choline, which is really good for the brain. It's got vitamin D, B complex, carotenoids, especially lutein and xanthine, which is good for your eyes and macular degeneration. And it's got selenium, right, which can be helpful for your thyroid. So egg has huge benefits, not in just the cardiovascular arena, but in terms of muscle building and brain function. Now, the only caveat to this is that if you actually have an egg allergy, obviously this is not for you. But for the general population, eating eggs can be a great benefit to their health. Now, not all eggs are made equal, right? If you go to the supermarket, you have a variety of different eggs. It says cage-free, organic, vegetarian-fed, all this stuff. At the end of the day, what you want is a pasture-raised egg. Not a pasteurized egg, but pasture-raised chickens that lay eggs. They're free to roam outside, not roam in a house or roam in a big warehouse. They're meant to go outside, freely roam, eat bugs and worms and whatever they want to eat, and then they're fed high-quality feed, right? So it's important. You need to have chickens that are pasture raised, free to roam. The best you're going to probably get is a local farmer's market or a local farm that you see the chickens just roaming around the entire farm or around the yard, and they're free to roam around all day long until they come back and lay eggs. Those are the eggs you probably want. It has the highest quality nutrients in there. So therefore, a pasture raised egg is best, and don't be afraid to eat eggs because it's good for you. Today we're going to talk about magnesium and high blood pressure or hypertension. And what is the stance by the FDA regarding food labeling regarding hypertension and magnesium? So let's get right into it. Magnesium is good for moods, migraines, premenstrual syndromes. It's involved in over 300 enzymatic reactions. Therefore, it's important for protein synthesis, nerve and muscle function, sugar regulation, and blood pressure. Okay? What types of foods have magnesium? Things like avocados, nuts, seeds, spinach, whole grain, legumes, yogurt, salmon. What is the RDA recommendation for magnesium? Ages 1 through 8, 80 to 130 milligrams per day. 9 through 13, 250 milligrams per day. An adult male, 430 milligrams per day, and an adult female, 320 to 360 milligrams per day. Now, most adults do not get the minimum requirement or the minimum RDA requirement of magnesium. What that means is they usually will need to supplement or change their diet in order to get the proper levels of magnesium into their diet. Now, I have a separate video on magnesium itself, all the different forms, dosages, etc. So I want to link that video below so you can watch that video. So this will make a little bit more sense to you. Now, what does the RDA or the FDA say? So there's extensive research on cardiovascular disease and magnesium, especially with hypertension. So the FDA came out in January of 2022, and it basically says it does not intend to restrict claims of benefits of magnesium and hypertension. So the statement really says, if the food that you're eating, or whatever packaged food, has more than 20% of the RDA, or 84 milligrams, up to 350 milligrams per serving, then they can make the statement of it may have potential benefits to hypertension. They can't claim that it reduces hypertension, but they can claim the likely benefits or potential benefits of magnesium and hypertension. That's big in a way because they're starting to recognize that there's extensive research out there for magnesium, and they're acknowledging that, but they don't want to come out and say that it cures or takes care of hypertension. Now, there are other studies, right? They've used 240 milligrams per day for uncontrolled hypertension. What that means is a person who is on a medication for hypertension can take 240 milligrams and it will reduce their systolic and diastolic blood pressure. Now, for the untreated hypertensive patient, they can use up to 600 milligrams or more to help manage hypertension, right? So these are the studies out there, and I'll link those studies below. Interestingly enough, they say dose matters more than the type of magnesium. So it's not the type of magnesium that you're taking that's going to lower your blood pressure. It's the dosage that's more important, right? Although one can argue that certain magnesiums have benefits, like magnesium citrate is important for, let's say, constipation. Magnesium glycinate is a good form for general health and magnesium absorption. Magnesium L-threonate can be great for nerve function or brain function or calming the mood and sleep. So there are other benefits to these types of forms, but the basic idea is that the dosage matters more than the actual form of the magnesium to reduce hypertension. All right? My name is Dr. Jin Sung, where clinical excellence meets excellent results, and we'll see you guys next week on the healthy side. Have an awesome day.